A number of Asian countries have stepped up border security after 2 cases of the rare but deadly Nipah virus were detected in India. While the virus has not yet been detected in Australia, authorities, of course, are closely monitoring potential threats. Here's Crystal Wu.
The Nipah virus is a highly deadly infection with a fatality rate ranging from 40 to 70%. The World Health Organization confirmed 2 cases in the West Bengal state of India, both healthcare workers who developed symptoms in late December. As of January 21, one remains under critical care.
It's raised a different level of concern just because they want to try and work out whether they both contracted it from another very ill patient who was there with undiagnosed Nipah virus infection, or whether it could be a signal of person-to-person transmission.
Flu-like symptoms typically appear within 2 weeks after infection. Nipah virus symptoms include fever, headaches, muscle pain, vomiting and sore throat. This can be followed by dizziness, drowsiness, altered consciousness and neurological illness. Encephalitis and seizures occur in severe cases.
If this virus could start to move from person to person, it would carry a different threat, not just in the region, but more broadly. But up to now, and it looks the same in this outbreak so far, it's very rare to see human-to-human transmission. So very different from COVID in that respect.
Nipah virus, which was first identified in 1998, has since been reported in Bangladesh, India, Malaysia, the Philippines and Singapore. The virus can be transmitted through infected animals such as bats or contaminated food. There is currently no vaccine available.
They're trialling a vaccine for Nipah, but we're not there yet. So that's the concern. We also don't yet have good treatments for it. So they manage patients by supporting them through their symptoms. But particularly for people that have either severe respiratory distress or develop neurological symptoms, as we've seen in these cases recently in West Bengal in India, it can have very poor outcomes.
Countries in Asia have tightened their border controls in a response to this outbreak, but the health minister says there's currently no need for changes to Australia's security measures.
We've got no advice to change those protocols at this stage, but we're monitoring really on a daily basis.
COVID was such an unprecedented time. It was a really challenging time for insurers and for customers alike. So the global environment was really challenging.
Travel insurers are warning people to carefully check their policies to ensure they're covered in the case of an outbreak.
So making sure that you disclose anything that might be relevant to your health situation, that you look deeply into the policy coverage to ensure that you understand what the policy does and doesn't cover.
Australians travelling to areas with known Nipah outbreaks are advised to avoid contact with bats and pigs. At this stage, the virus has never been detected in animals native to Australia. Crystal Wu, Sky News.